Hi, I'm Dr. Jay Varma, and welcome to Thermometer. On this channel, I check the temperature of health in the United States and around the world, and I give you expert insights on infectious diseases and public health. This is the weekly episode of Inside Outbreaks, and on these episodes, I review the latest outbreaks of infectious diseases, the outbreaks that you need to know about. And I do this with my friend and colleague, Dr. John Epstein, a veterinarian, virologist, and disease ecologist who, like me, has spent his career tracking dangerous infectious diseases across all corners of the earth. Thanks, John, for joining me today.
Thanks, Jay. It's good to see you.
Yeah, it's great to see you, John. So anything new and interesting going on in your life these days before we get into our weekly summary of bad events that are out there?
Yeah, no, listen, I got to say, this was interesting. I was thinking about this. I'm not a big concert goer, but I recently went to a big stadium show the other day. I saw a concert and it was indoors at a basketball arena. And I was thinking about this. It's always in the back of my mind now, like perfect conditions, right? Indoor concert, people screaming their head off. What respiratory disease am I likely to get from being there? And I found myself in the position of not really overly concerned because these days, I just got my COVID vaccine, my flu vaccine. I feel like, okay, it's a balanced risk. But for the fact that this coming weekend, I have a speaking engagement. I have to be somewhere and talk. And I really wanted to make sure I didn't get sick. So I wore a mask during the concert. And it was just an interesting moment for me where it was a deliberate decision. There was a reason for doing it. There was definitely a reality where I might not have worn it, but in this case I did. And it was nice to see that it felt totally comfortable, meaning no strange looks. It's just acceptable now to do that. There were a smattering of other people who were doing that for whatever reason. Most people weren't, but I took some comfort in the fact, perhaps in a post-COVID world, that this is now a pretty normal thing to do.
Well, so that raises actually two interesting points. So one is kind of social norms. And the second is, kind of what our personal risk tolerance is and why we may or may not mask in certain things. So I guess the first point I'll get at is social norms. One of the things that one of the reasons why what I was trying to push for after sort of the peak of the pandemic was that, facilities in New York City or any other place, what I was hoping there would be legislation on, would be required to stock and supply high quality masks, basically at kind of the entrance, just like you see like hand sanitizer, and all of them are required to stock, for example, a fire extinguisher or a defibrillator or a first aid kit. And the reason for that was basically to start to create a norm so that people don't have to wear masks. This isn't a mandate, but it becomes available. And so therefore, when people who do wear masks do it, they don't look like they're unusual or strange or weird in some way. And it's accepted.
It's a good idea. And of course, having it on hand and available can make the difference between someone who says, oh, I wish I had a mask and doesn't, versus like, great, now there is one, easy to use.
Yeah. And we have actually a perfect analog of this in infectious diseases. I've spent a lot of my career working on HIV and sexually transmitted infections. And, while condom use has changed dramatically in recent years with the advent of, medicines to prevent HIV, lots of studies that were done in sort of the pre-PrEP era showed that widespread availability of condoms, so basically flooding bars, hookup spots, bathhouses with condoms, did increase condom use. Now, never get near 100%, but even increasing condom use 5 or 10% can have a big impact on transmission of infection. So that was the analog that I was always argue for is, look, we don't need to require people to do things. I mean, I can absolutely understand people's concerns about civil liberties, but at the same time, we can also make these things widely available and abundant so that the people who do want to use them face no friction in using them and no social condemnation for using them either.
That's important. And the social pressure is an important one. Again, not just having the mask available, but feeling comfortable using it, knowing that, you do it, you're not going to get funny looks. It's not going to be weird. And then you get all the benefits from it.
And John, I think you raised a really important point here too, which is about, the episodic use of face masks. And I think this gets drowned out in a lot of this sort of like hyper emotional anti-mask vitriol out there, which sees it as somehow like a I don't know, like a Biden Obama flag or something. Like it's become this like
No,
partisan thing when
politicized.
it's just a medical device
Yeah.
that people should consider using based on their individual risk and the events that they're going to and their concerns. So for example, I am thankful that I don't have any health conditions that put me at high risk of COVID related complications. I've gotten annual COVID vaccine, so many ones. I'm going to get my next one, next week. But I still will wear a mask in certain settings, such as when I take a plane flight, because on the time when you're boarding that plane and when the time that you're deplaning, you're sharing a lot of air with people. And if I'm on a plane, it means that I'm traveling somewhere. And I just don't like getting sick. It has nothing to do with like me being deathly afraid of COVID. I just would rather be healthy if I can.
Yeah, if you lump all these things in the category of personal protective equipment, I think people are very good. It's natural. Like you're going out in the backyard, you're going to do some work. Maybe you're picking up firewood. You don't want to get a splinter. You put gloves on, or you're working at a work site. You put on boots, not open-toed shoes. Physical hazards seem obvious to us in terms of protection, and we'll wear clothing accordingly to what hazards might be present. And I think getting biological hazards into that frame of mind it's just that it's a matter of just thinking about it. And as you say, a mask is just a way to prevent us from a hazard that might be present in a specific situation.
Yeah, and it's just unfortunate that, that it's become this idea that somehow, people, I'm glad you didn't face any sort of negative commentary, that, some people feel compelled to comment on what other
I know.
people are wearing. It's just, what type of world do we live in where if somebody's behavior is not infringing on my freedom in that respect, it doesn't really affect me, right? It does affect me if they're exhaling pathogens, right? If they have drug-resistant TB or they have active COVID, yeah. Well, that's a
Right.
situation in which what they wear and how they act could put me at risk. But if you're just in a regular other environment, I don't comment on I don't know, the bad fashion choices that a lot of Americans make.
That's right.
Yeah, it always just seems very odd to me. So.
No, well, this was a positive experience. I did it with intention. It was fine. It was good, and it's something I would continue to do and recommend to others if you're in a situation where you're worried about getting a respiratory infection.
Okay, well, since we're on the topic of respiratory
Oh
infections,
yeah, here we go.
let us launch our infectious disease rounds. And again, for people out there who are listening or watching, we are running through the sort of five outbreaks or clusters of infectious disease that
Hmm.
we're interested in watching right now. Not necessarily the ones causing the most disease out there, but the ones that are kind of the most interesting and highlight some important points about our lives and the risks that we might be taking and what we should be doing. So let's start off number one on the topic of respiratory infections. Bird flu is
Hmm.
back in the United States, John. Okay. And the real question is, what's going to happen to egg prices? And secondarily,
I
what's
don't
going to
know if
happen to
that's the real question that
what's going
as
to
I
happen to
think
human
about it,
health?
but I know that's important to a lot of people.
Exactly. And I did that very intentionally because we know that there was a lot of talk before this election about egg prices. So I started off by saying, first, let's talk about egg prices. Then let's talk about human health. Okay, so let me get into it. So why are we saying that bird flu is back in the US? So it turns out that, there was a lull over the past
Hmm.
couple of months, but now we're seeing in poultry, particularly in chickens, that bird flu cases are spiking again. More than 4 million poultry birds have been culled in the last month in states including Minnesota and Iowa after poultry in those flocks tested positive for the H5N1 bird flu virus. More than more than 4 million poultry birds, is a lot, right?
Yep.
And it
Yep.
corresponds to a spike in infections detected among wild birds as well, too, in northern states.
Yep.
So the question, John, is what does this mean? We have been following this very closely, and obviously avian influenza H5N1 has been around since the late 90s, hasn't really spilled over into causing a human health epidemic. So really a lot of the concern at the moment, and that's why I raised it before, is economic, right? What might be the impact on food safety and egg prices?
Well, I think it's twofold. And I like the fact that we are raising attention to what really right now is an epizootic or an outbreak in animals, right? So these are chickens and turkeys, right, on poultry farms that are getting infected. And the reason that we're seeing an increase has to do with wild bird migration. We know that all influenza viruses originate in migratory waterfowl, migratory birds, and H5N1 is no exception. So as birds are beginning to move through North America and move down towards southern latitudes, okay, flying south for the winter, they stop and they find sources of water, they find lagoons, they find ponds, they find areas to rest on the way. Those might be around chickens or poultry farms, either big ones or backyard ones. And that's where transmission has an opportunity for this virus to get from wild birds into poultry. And then, of course, it spreads very rapidly among poultry because they're at such high density and it's highly fatal. So, as you mentioned, millions of birds are being affected. Those birds have to be culled in order to control the outbreak on farms. One outcome of that is decrease in egg supply, so prices go up. But I think the question, Jay, that we're really thinking about is, as we see an uptick in poultry cases, are we now going to see it jumping back into dairy cows? Are there going to be more mammals in the United States and the Americas getting infected, wild mammals? And of course, as we've talked about before on the show, every time this bird flu gets a chance to infect mammals, there's a chance for it to evolve and become adapted to mammals. And that, of course, has implications for people.
Yeah, and what are your thoughts about, if bird flu cases are increasing at the same time that influenza season begins in humans? So again, we're talking about one strain of influenza is what we're seeing primarily in, a huge number of animals, but very few cases occurring in humans. But at the same time, we're about to get the usual winter seasonal influenza in humans as well too. Does that increase the chances for, reassortment and potentially getting a strain of bird flu that has kind of the pathogenicity of bird flu combined with the transmissibility of the human influenza?
In theory, but right now the risk to people is considered very low in terms of H5N1. The seasonal flu we worry about is a different strain of flu, and that one is spread readily among people. That's the one the vaccine gives us the most protection against. So while it's theoretically possible if someone were to be infected by H5N1 and say H1N1 or one of the seasonal flus, there could be a gene swapping that occurs among those viruses and reassortment, which could lead to a different strain. But right now, generally, people's exposure to H5N1 is pretty limited. And it's, of course, something we need to track and make sure that it doesn't become more prevalent.
So, John, the other thing, so we did talk a little bit about egg. So we've talked about, the risk to animals. We've talked about the risk to humans. We've talked about the risk to egg prices from this increase in bird flu infections. But what we haven't talked about, John, is what is the risk to turkey prices? Thanksgiving is just about a month or so away. So what do you think is going to happen to the price of turkeys if bird flu is spiking, here in mid to late October?
Yeah, I mean, well, certainly if some of these big industrial farms are getting hit and having to cull turkeys, then supply goes down and prices may go up. I always like to buy my turkey from a local farm if you happen to be fortunate enough to be near one. And of course, hopefully that local farm isn't experiencing H5N1 transmission among its flock. So in some cases, prices may be stable, especially locally, but maybe nationally, maybe with these bigger distribution chains, we're going to see a little bit of an uptick just in time for Thanksgiving.
Okay, well, let's hope that this doesn't spread much further, and then in fact we can all enjoy eggs and turkey, and the animals stay alive as well too. But it is coughing season for other reasons as well too, and one of those has to do with a topic that we touch on pretty regularly here, which is anti-vaccine sentiment, and that anti-vaccine sentiment is leading to really widespread epidemics across the United States of pertussis, a bacterial infection also known as whooping cough. And what you're seeing in Florida, which is kind of at the vanguard of the anti-vaccine movement, is that cases of whooping cough have risen by 81% this year. As of the end of September, there have been almost 1,300 pertussis cases reported to the Florida Department of Health, compared with 715 in all of 2024. And 63% of the cases that have occurred in 2025 are in children under the age of 10. And the real challenges here is this is occurring where the Florida Surgeon General, the lead health official in Florida, Joseph Ladapo, is pushing to repeal state vaccine requirements and basically saying, hey, you're no longer required to get the pertussis vaccine as part of school entry.
First of all, that's a beautiful synopsis. Jay, I have to say your aura is showing through. I think the sun is hitting your
The
camera
sun
in
is
such a
hitting
way.
my camera in a
Yeah, you're
very
getting
weird
some really
way.
bright flashes. So I'm sorry to interrupt, but I don't want people to be overly distracted by this beautiful rainbow coming off your
Oh my goodness. Okay, I'm going to adjust this as we speak. I don't know exactly what's going on here,
it
but
looks
let's
like
just.
sunlight's coming in across your camera, perhaps. You have a shade
Okay.
open.
All right. Well, I will temporarily turn my camera off, and then we will Yeah.
Okay. All right. Well, but you asked the question about vaccine and vaccine preventable diseases. And I think here again, we have a case where we're going to see an uptick in all of these childhood illnesses like pertussis, like measles, whenever vaccine coverage drops below its usual levels. And it's easy to take for granted when we have vaccine compliance and recommendations that are universal and that are just unequivocal, that childhood vaccines are important, that they protect your children from health, and that has tended to keep a lot of these infections at bay. But it's not overly surprising to me, particularly in areas where maybe there's a little more vaccine skepticism or hesitancy, and certainly messaging coming from state health agencies that childhood vaccines may not be mandatory, or leaving, a bit more ambiguity as to the utility of the vaccines. So, Jay, this story doesn't come, sadly, as a huge surprise.
All right. Yep. And sorry about amateur hour lighting. I guess I was had some natural light in my room here, and I thought that was going to work
It was
well.
it
But
was
it looked like
great.
it conflicted with the other lighting in there as well. So okay, we're back, and yeah, I excuse all of us for my amateurishness. But John, I think you touched on the key point here, which is that these are highly preventable infections, and it's really unfortunate that we're going to see a combination of both bacterial infections like pertussis combined with influenza, with COVID, with all the other things that come seasonality. And I just, I do think there's a real risk that we could be facing some very unusual respiratory illnesses, some combinations of things that occur all at the time. And it's going to be very difficult for doctor's office and epidemiologists to kind of figure out what exactly is happening if this continues like this. And it's obviously bad for individual health as well, too.
Mm-hmm.
Okay, so let's get into the next item in our infectious disease rounds, and this is Legionnaires' disease. And we've touched a little bit before on Legionnaires' disease, but there's a reason I'm bringing this case up here too. So the Illinois Department of Health is reporting that there's a cluster of 2 Legionnaires' disease cases that have occurred at people staying at the Alden Valley Ridge Rehabilitation and Health Center in Bloomingdale, Illinois. So there was an environmental investigation conducted after 2 people became sick. And that environmental investigation found that the Legionella bacteria was in samples from a patient's room and from the cooling tower. So just to confirm, just to clarify, these are 2 different sources. One is like the tap from the faucet or from the shower that has Legionella, and the other one is the cooling tower that occurs on the top of the building. And so now they've issued an alert to people who are people living in this facility, as well as people who live in the outside vicinity of this facility.
Mm-hmm.
And so the reason I wanted to point this out, John, is this is an example of something, we've talked before about Legionella in cooling towers and how it can spray into the community in New York. We've talked about it in hot tubs and how it can spray, but we haven't talked so much about indoor plumbing as well, which is another possible source of this bacteria.
Yeah, no, it's a good point. And again, a common factor is bacterial contamination of a source like the cooling tower in this case, but now it's traveling through plumbing. And I don't know how frequently this form of transmission occurs versus the other, but it's good to bring this up as a potential, transmission route.
Yeah, and it's particularly a challenge for anybody who is elderly, who has any type of immune compromise, because what happens is when the water comes out of these taps or comes out of the the shower, it can spray and essentially forms an aerosol. And then if you inhale that, you're going to put yourself at risk. So one form of Legionella that we worry about is the Legionella that's found in cooling towers. That sits at the top of a building and it sprays into the air, so that anybody walking below or with an open window is at risk of breathing that in. And the second is this form of Legionella that we worry about, which is Legionella inside the water taps inside your building, which is particularly a risk if you have any type of conditions that predispose you to get severely ill. And that's, like I said, the elderly
and it's
and compromised. Yeah.
This is a good story to bring up because it also, we don't normally test shower water for, bacterial pathogens, right? You might test water quality for bacterial count if in terms of drinking water, but not looking for Legionella. So as soon as a case is identified, understanding that it could be a point source contamination that could affect multiple people who are exposed to the same source is really important for preventing additional cases.
Yeah, absolutely. And this is one of the reasons why, maintaining, good, clean water systems is particularly important in any type of healthcare facility, or in this situation, any type of assisted living facility in which the people are kind of immune compromised or at risk from these. You got to really be careful to make sure our water quality is the way
Mhm.
we want it to be.
Yep.
Okay, so we've talked about Legionella before, so that is an easy segue into a problem that we have touched on
Yeah.
before, but appears to be getting worse this year, which is norovirus on cruise ships. So if you go on a cruise, and a lot of people are probably going to go on cruises as the, holiday seasons emerge, you've got to be worried about outbreaks of diarrheal disease, unfortunately. And it turns out there is yet another big outbreak of a norovirus on a Royal Caribbean cruise ship called the Serenade of the Seas. It departed San Diego on the 19th of September and then was ultimately going to dock in places in Central America like Costa Rica and Panama and Mexico, and then eventually dock into Miami. And more than 90 passengers and several crew members have fallen ill. And the big story here, John, is this is part of a kind of a wave of norovirus outbreaks. In 2025, there have been 19 reported outbreaks of norovirus on cruise ships in the United States, which greatly exceeds the total number from the year before.
That exceeds the total number from cruise ships the year
Yeah, from
before?
cruise
So
ship related
okay,
out. In other words, cruise ship outbreaks have gotten worse this year
gotten
compared to
worse.
previous years. Yeah.
That's interesting, and you wonder, is it, less stringent sanitation conditions on cruise ship for some reason? It's hard to imagine that things would have changed that much year to year. I mean, any sense as to why this might be happening?
Well, I think that's really kind of one of the big question marks here, right? Is this a change in sanitation? Is it a change in the virus? Is it a change
Mhm.
in some other factor that we don't know about? Maybe there's contamination of water systems or contamination of food sources that's somehow introducing it, into the crew or into the passengers going on there. But it's just another example of the fact that, whenever we're going to bring people close together
Yeah.
in close quarters, you're going to put yourselves at risk. And so, if people love cruises, please go enjoy them, but also recognize the fact that you're going to be put into close quarters with a lot of different people. And unfortunately, one of the biggest risks is this virus, norovirus, which has the ability to spread very easily from person to person, that can persist in the environment. So it makes it really, really hard to remove from a cruise ship once it's already been introduced. And that might be explaining why you're seeing this, big rise in the number of outbreaks that are occurring on cruise ships this past year.
Yeah, it's hard to imagine something that would make a cruise less pleasant than getting a norovirus infection and being just ill for, the duration. So, it's a real concern, and it's hard because there isn't an easy way to protect yourself from it if you're in that situation, right? I mean, you're eating the food that's provided on the ship, you're exposed to surfaces. It's a little bit different. I mean, good hand sanitation, good, hand washing is of course very important, but again, there's just certain elements that put you at risk.
Yeah, no, without question. And I've been on done cruise ship outbreak investigations before. And to be honest, for these large scale huge cruise liners, the companies invest a tremendous amount of money in trying to make sure their passengers stay healthy and that the
Mhm.
facilities are clean and that the food and water is carefully managed and stuff, because this is a tremendous economic loss for them, not
Right.
just for the people who are on that cruise itself, but for their brand reputation as well
Absolutely.
too. And so this is one area in which there is a very strong vested interest from the commercial side of this to invest in health. And obviously the passengers want to do it because for some of them, this may be the trip of a lifetime, right? They may have
Mhm.
saved for years for
Yep.
something like this.
Yes.
Okay. So the last sort of infectious disease rounds topic I wanted to cover here, and I wanted to do it because it's somewhat an unusual disease, but you do see it occasionally popping up in cases, in the United States, is melioidosis. So this is a bacterial infection that there have now been a cluster of cases in Hong Kong during September. There were 3 cases that were reported in Hong Kong in September. One was an 81-year-old man with pneumonia. The second was a 73-year-old woman with bacterial sepsis. And the last was a 44-year-old man who developed pneumonia and sepsis and then died from this infection. Now, what the Hong Kong health authorities are reporting is that all 3 of these individuals who got sick had pre-existing chronic conditions, and there hasn't been any epidemiologic link to all of them. So, John, where are they getting this unusual bacterial infection from that seems to make people severely ill, and at least one case has killed them?
Yeah, this is a bacteria, and it's interesting because it happens to be one that's considered, a high consequence pathogen by the CDC and U.S. government. It's listed as a select agent because it can be so deadly. It's available. It's ubiquitous because it tends to occur in soil, in the environment. And this particular bacteria, Burkholderia pseudomallei, is prevalent in Southeast Asia. And I remember actually working in Malaysia and discovering there were cases of Melioidosis in people. And so they get it usually when there's disruption of the soil after a big typhoon or flooding, or a storm that kicks things up and vegetation gets contaminated with soil. It's not dissimilar to anthrax, Jay, which we have here in the United States, that lives kind of dormantly in the soil and gets kicked up after a storm, a hurricane, and can get onto vegetation, and animals or people can get infected that way. So tends to be environmental contamination, drinking water surfaces after a big disruption like a storm.
Yeah, and so that's really the concern that we have here is that this is a infection that again that can come up from the environment. So there's very little that an individual human can do to actually protect themselves, right? Because it's going to get thrown up into the environment. And this may be an
Mhm.
example again, if you were wanted to be incredibly like diligent about wearing a mask or something, that could certainly make a difference. But it's not the thing that the average person would pay attention to, but it can cause some really extremely severe infections. And so I think it's important for clinicians out there to think about if you're ever evaluating. It's a classic kind of boards question. In medicine is, a person comes back from a trip to Thailand and has a severe pneumonia. What are the possible sources of infection that when they get severely ill, and this happens to be one of them.
That's right. Travel history becomes really important. And, just to mention, this is a bacteria that affects animals too. Domestic animals can get infected: sheep, goats, pigs, cattle, horse, dogs. So it's an equal opportunity pathogen in terms of different species that can get exposed similarly.
Yep. Okay, John. Well, that finishes our infectious disease round. For our focus topic today, I didn't actually want to talk about an outbreak, but I did want to talk about the news. And, I think we've been covering this. It's been kind of a wild and unfortunate year in public health.
Hmm.
Back in the beginning of April, on April Fool's Day, there was just a mass set of firings at CDC. Thousands of employees got notices that they were going to be fired. Some of those got rescinded, but it was basically just a mass closing of major programs, and an announcement that they were going to basically shut down a huge number of programs completely, transfer some of them out of CDC to a new agency that hasn't been created yet. So this was all back in April. And then, about a month or so ago, there was another event, which was that, many members of CDC's leadership team quit after they were threatened with being fired for failing to follow along with anti-vaccine sentiment, and anti-vaccine policies that weren't based on science. And now we have what happened a week ago, which is that on a Friday, late in the afternoon, over 1,500 employees at CDC got notices saying that they were being fired. The term that's using is called RIF, which is a reduction in force, a bureaucratic term used in the federal government to basically just means you're getting fired. Then we find out that a lot of those employees that were being fired were from some pretty critical and essential
Hmm.
programs. And since that time, because of a massive, presumably the media outcry, and then this affected both Democratic and Republican, constituencies, about 600 or 700 of those 1,300 employees have appear to have gotten their jobs back. But it is just a real mess right now, John.
Yeah, that's got to be completely, number one, chaotic. Feel, psychologically, you must feel horrible. You're told that your job is no longer important. You're being fired, not for any reason, not for cause. Then the whiplash that occurs when, just kidding, we actually need you to come back. I mean, I read, Jay, that they even had brought back HR professionals so that they could fire other members of the CDC. I mean, this has got to just be absolute destruction for morale, is what I'm thinking within the organization.
Yeah, well, without question. It's and the thing is that, this is an agency that has thousands of employees, but and these are, I've worked there for 20 years. I mean, like any organization, like of course, like every organization, there's some redundancy and some things that get cut, but that's not what this is about. Because if it was about, trying to improve efficiency, there would be a very rational process to look
That's
at
right.
what programs should be cut or not because they're not as effective as they should be, or because their functions could be picked up by other people. I, fully accept that every organization, public and private, could probably be done more efficiently. But what's happening here is essentially it appears, and I emphasize appears because there is no document that like
Right.
HHS is releasing saying, look, we're getting rid of these programs for these reasons. Literally, the people I know at CDC are crowdsourcing. Who's been fired? Do you know somebody? And like creating like Google Docs to literally keep track of this. And I'm not joking here, to figure out what's going on. So the process is just incredibly chaotic. And you see that because they're firing people, then bringing them back. We also know it has no rhyme or reason because they claim that what they're trying to do is make CDC only focused on dangerous infectious diseases. But in fact, they cut a number of people working on the Ebola response.
That's right. Yeah. Jay, perhaps, one of the things that concern me the most, and to your point about there being a real lack of intentionality or rationale as to, what they're cutting and why, is that they eliminated the entire Washington, D.C. office. Now, think about the importance of communicating information on public health to policymakers who are all in Washington, D.C. The function of that office was to brief Congress, probably to brief, the White House. I know the director's job is to do that, but they've cut off the communication point for the entire institution, to the entire agency, to lawmakers. So how are they going to get accurate information about what's going on in the United States?
Well, it goes beyond that as well, too, John, and which is basically that when you look at public health agencies, they essentially, sorry, let me get some water here. When you look at public health agencies, they essentially, one of their most essential functions is they take in data, they turn that data into useful information for the
Right.
public, for healthcare providers, for policymakers, and then they do something to get that data into the hands of the people that need to use them. Right? Putting out guidelines, putting out advertising, things like that. That's kind of considered an essential function of public health. And as you point out, one of the things that they're trying to do is centralize all of that communication within the Health and Human Services. So above CDC as an agency, within political officials. So one way to do that is to cut off, as you said, the CDC Washington office, which primarily works on briefing elected officials. It briefs on
Mhm.
basically the entire infrastructure of DC. It serves as the organ to communicate to all of the different branches of government about what CDC is learning, what it's doing, what its priorities are. That's one thing that was cut off. Another thing that was cut off was CDC's MMWR, which is the
Right.
Morbidity Mortality Weekly Report, which is the kind of like gold standard for releasing public health information. It's how the HIV crisis was first detected. It's how like West Nile was publicly reported to
That's right.
people, and the SARS epidemic. You go run down the list. And, several people I know were editors were fired. I'm not sure if they've been restored. I think some might have been because there was a, pushback on that. But that's for now. I don't know what's going to happen next after this, right? And then in addition to that, I would say one other piece of information, one other piece here is actually the data collection itself. As of now, as of today, many people in what's called National Center for Health Statistics have been cut off, including the survey that's used to document what types of foods American is eating. And this administration claims to care a lot about the quality of food that people are eating. Well, the way we know what people eat and don't eat is through these large surveys that CDC does on that. And that's being cut too.
Yeah. I mean, if one of the things CDC was doing, I know post COVID, was working on a way to modernize, to update their data collection and aggregation nationally. I think, one of the big concerns from the COVID outbreak was that it was very hard to collect data from all the different states and process that, as you say, to analyze it and get a sense of patterns kind of across the country. The data collection methods were different depending on the state. The reporting was a little bit different depending on the state. So CDC was in the process, I know, of trying to unify all of this and make it more effective. And I think that has also been disrupted by all these firings too. And so now we wonder, how effective will the agency be if there was another epidemic in the United States?
Yeah, and I think we've been sounding this alarm or beating this dead horse, whatever the right metaphor is,
Hmm.
um, throughout the year. And unfortunately, the news just keeps getting worse and worse and worse. I mean, they originally fired all of the disease detectives at CDC, at least all the ones that are what's called civil service, which is a fair percentage of them, only to again bring them back again. One of the people in one of these that I communicate with at CDC literally sent a message saying that I've now been fired 3 times in the same year.
Right.
I mean,
And another thing, and maybe you could elaborate on this, is that in addition to firing, some people get put on administrative leave and then reassigned. Like I speak to people too at CDC, and I know someone has been reassigned to, Native American populations, whatever, but then not really told where to go. So they were taken off their job. They're still being paid, but they're told they're going to be reassigned or relocated. And then that information never comes. So they're kind of in limbo and don't know what to do.
yeah, well, it's also revealing what's really going on, right? I mean, what HHS has said is like, look, we're responding to the needs of Native American populations and assigning you experts because you've been neglected for far too long. That actually sounds good. I mean, it is
Right.
obviously true that there are major health disparities
Yes.
on Native American populations. I myself spent a month of my residency working on a Navajo reservation, Tuba City, Arizona. I know how bad it is there. That is not what's going on, because if that was what was going on, as you rightly point out, several of these people, including major leadership people who've been told that they were assigned to IHS, would have actually had assignments that, first of all, that matched their needs, and second of all, would actually have been told to go, but they weren't. It was meant to be punitive. And that's what reveals the kind of insincerity of what's going on here.
Yes.
Is it's really just an attempt to destroy public health. It doesn't appear to be any attempt to actually reshape the agency within a vision that's coherent.
Yeah. I mean, leadership at HHS, RFK Jr. has publicly said he thinks CDC is an incredibly corrupt organization. So that sets the framework for maybe his motivation for breaking it down. But I haven't heard him present a vision for how to recreate it in a better way, or how this is going to lead to any improvement.
Well, sure. And let's just be very clear to everybody out there right now that, when you're hearing messages from Washington, be careful about what they're saying versus what they're doing. So RFK Jr. has said that the COVID vaccine is dangerous and that it kills people and that nobody should use it unless they absolutely positively have to. The President Trump, just had his annual physical or updated physical a week ago. And the White House, to its credit, put out a press release about that. Guess what vaccines President Trump got?
Absolutely. Absolutely.
He got the influenza and the COVID vaccine this year. And that is what I would tell all of you to do. So don't listen to the words that are coming from elected officials that are saying that vaccines don't work and they're dangerous. Look at what they actually do. President Trump got his annual COVID and flu vaccines, and I would strongly encourage everybody out there to do the same thing.
Yep. It's a good message.
All right, John. Well, that wraps up our episode. I am sorry. It looks like we had some lighting difficulties today. I think both you and I got a frog in our throat at some point.
I know. It jumped right through the camera. It
All
was
right. Well,
agent in action.
And if we were professional podcasters, we'd have a skilled producer somewhere in the background to rework all of this and turn it into magic. But that producer is going to.
Instead, you have to watch us chug water in the middle of a sentence. That's
exactly.
the best technical support we
downloading this and uploading this in very amateur fashion. But we are not amateurs when it comes to infectious diseases, and we appreciate all of you out there who listen to us. And so please comment, please share, please like these episodes. And John, we had a lot of viewers last week for one clip that I made. Do you know which clip that was?
No, Jay, tell me. I didn't see
it. Was about pink eye in Texas. So, we covered it. We talked about an outbreak of conjunctivitis from a rare strain of meningococcal of Neisseria meningitis. It was like a unencapsulated strain of the bacteria. I thought it was an interesting outbreak to present. Interestingly enough, that video got a ton of views. So anyway, if any of you watching to the end, to this bitter end of this recording, have any insight into what you want to hear about, please let us know. We want to give information out there about topics that people find interesting. And obviously, the more people that know about what's going on, the better our health will be.
Great. No, I think it's good. And thank you all for tuning in. We really appreciate all the support we've had so far. Keep it coming. Share us with your friends, and we'll see you next week.
Great. Thanks a lot. Bye-bye.
Bye-bye.